As trauma centers in general started sprouting up around the country in the early 1970s, it became recognized probably within the first decade of their existence that pediatric trauma in the childhood age group was different. Then I think people stepped back and started to realize that probably 90% of the injuries that we saw in these pediatric trauma centers was preventable. And people that were taking care of these traumas every day, and I was one of those people, were facing a real dilemma. Are we going to satisfy ourselves with building up beautiful facilities to take care of kids that are getting injured, knowing that most of them shouldn't be here to begin with?
I have been a pediatric emergency physician for pretty much my entire career. Pediatricians and emergency physicians and trauma surgeons who take care of kids realize that a lot of the work we do is patching kids together after they've had a completely preventable event.
We've been able to build up our set of curricula to cover really most of the major injury events that kids might be exposed to from ages 0 to 17 now.
Every 2 weeks we have a child passenger safety check where people can come and either have their car seat that they have already, make sure that it's installed properly, or we also are able through different grants to supply car seats to people who don't have them or can't afford them. We've also done a pilot program with teenage moms talking about injury prevention in the home with their young children. We have Goods for Guns, where people have the opportunity to turn their guns in. It's an anonymous turn in your gun. We give bike helmets away, we fit them on the kids, and hopefully they wear them.
Overall, the Mobile Safety Street program is a real labor of love that I think in the long run has the biggest bang for the buck.
I actually had one student, and this happened last fall. He attended a school, one school in the fall, and we went with Mobile Safety Street, and he came through the program. And then later that year, we went to a different school to run the program again as scheduled, and he had switched schools. And so I was going through Mobile Safety Street for the second time. And it was great because we actually got to see our teaching in practice. He was able to perfectly execute everything on Mobile Safety Street, and he remembered from several months earlier.
The program that I've been the most heavily involved in, and I think that means the most to me because of the exposure that I get to these types of patients in the emergency department, is the teen driving program. There's an enormous number of teens that we take care of here that are very badly injured in motor vehicle crashes. And we don't call them accidents because they're not accidents. They're preventable events, they're crashes.
The students are given an opportunity to come in and drive the simulator and experience what it would feel like to drive under the influence of alcohol or drugs, and also distracted driving using a cell phone. They're definitely cocky, and they're not quite as cocky after they see what some of the consequences are. I think it puts it into perspective for them that it follows them around for a long time and it's not just an accident.
All of the things that we have on the street are things that we see, unfortunately, almost every day back here in the trauma bay, and it really is the best hope that I have that if we could insinuate this into the education of the surrounding communities and their health education programs, that's our inoculation program for most of the major injuries.
One of the things we've tried to teach medical students through our injury prevention program is there's another way to approach medicine as a whole. What we're teaching students is that medicine is a piece of a big public health continuum, and what happens in a hospital is really just a very small piece of it. So that part of their roles as future physicians is to be aware of public health issues that exist in their community and injury prevention is a huge public health issue.
I think the med students are a great bunch, and actually, you know, everybody's here because they want to be here, and this is something that they care genuinely about, whether it's injury prevention or some other interest. My hope is that the message that Dr. Hirsch and Dr. Mano are trying to get out there can spread. We can teach people to do very basic things, like Allison was saying, how to cross the street, or how to take that extra second to think about those things, and it can make a big difference in their lives and in our lives as physicians. We can kind of cut our business, which I think is a great model to have.
When you think about it, everything we do is trying to change the behaviors, trying to change the attitudes, and I think it makes a really big difference.
I work with heroes every day. Dr. Hirsch and Dr. Mano, they don't do this as part of their job. It's above and beyond. It's something they do because they believe in it.
It's impossible to, turn down the opportunity to be involved in projects that I really do believe will make a difference in the lives of kids and will mean that I'm seeing fewer patients here.